Hello, everybody, and welcome back to the Health Optimization Medicine Podcast. We're live in studio, recording in DC. We're so excited to be with you. We have Dr. Jup, Dr. Allen, and Dr. Ted, of course. Today, we're going to be talking about what nobody told you about your gut. And the first question is for Dr. Ted, is when a patient comes to you with depression, anxiety, or brain fog, and the psychiatrist has already tried multiple medications, where do you start looking and why? And why is the gut such a big part of this, Ted?
Yeah, I asked the patient or client, what are you eating? And why is that? There's a saying, you are what you eat. And the reason is that the gut microbiota actually pre-process all of your food. So everything that you eat is actually pre-processed by the gut microbiota before they even enter your body. So that's my initial question that I ask.
Well, we know there's been lots of studies over the last several years where we're absolutely positive that there's gut microbiota challenges with so many out there that are associated with things like schizophrenia, depression, bipolar. And so, well, why is that the case, right? Because there's this axis that we've heard of before. We've typically called it the gut-brain axis, but there's something missing there. Yeah, what is that missing part?
Well, I don't know if this study when it was done, but wasn't there a study done on twins where one was depressed and the other wasn't, and they gave a microbiome transplant? So they transplanted the microbiome of the twin that had depression to the healthy twin, and he became depressed, and the other twin became happy again.
Skinny mice and the fat mice. Yeah, they've done those too. So that's, you're talking about the missing piece, which is the microbiome itself, right? So it's not just the gut lining and the brain hanging out. It's also the microbiota as well. And there's also this other aspect, which Dr. Till likes to talk about in his lectures, called inter-kingdom crosstalk. So you have the microbiota, they're not only communicating with each other, they're communicating with ourselves via these vesicles and like talking to our mitochondria. And so there's this huge axis, and so it's called the gut microbiota
Brain axis.
And brain axis. Yes, exactly. So I almost got rid of it. Yeah.
Is your gut fucked up?
Yeah, I mean, it might be right now. That's been a couple of days in DC, so I don't know.
Something interesting. I still work in acute care, and one of our residents, we just started a psychiatric residency, and as part of it, they have to do scholarly projects and research. And one of my psych residents that was rotating approached me and said, "Hey, I have a really novel idea that I wanted to do a poster on." And the last several months, she actually did a poster on patients that came in that had treatment-resistant depression, schizophrenia, mania, and got approval for a grant to actually do, it was just a simple test of dysbiosis. There's no unfortunate treatment arm. But what she found was that nearly 100% of those patients that had treatment-resistant mental health disorder had dysbiosis. And again, we ran out of funding, so we couldn't really do additional studies. But what we do know is that the gut is the largest repository of serotonin receptors, right? And even more so than our brain. Ted, did you want to?
Yes, sir. Okay, so what he's saying, it's now on tripartite axis. Before we just said the gut-brain axis. Now it's the Gut-Brain-Enteric Microbiota axis. It's tripartite axis. Another thing, in addition to what Dr. Allen here has been saying, is that there's also another study that was done where they were giving an oral cancer drug to patients, and then they wouldn't work in some. And when they tried to assay the microbiota, they found out that those who were non-responsive were actually like 2 species of bacteria. And when they added those, the patients became positive for response. And that's why I actually look at RCTs, of randomized controlled trials, as really cannot control your gut microbiota. And that's always been my thing. I mean, RCTs are really good for acute care, right? But not for chronic diseases like the cancers that you're talking about.
Yeah, that's a big one you always talk about, is that randomized control trials, why do they change their data every 5 to 10 years, right?
Or maybe we need a new treatment. We need another arm that's studied that looks at a subgroup of those that have dysbiosis and those that don't. And then from here we'll find, but again, that
harder to do.
For those researchers out there, put that in here.
Yeah, dude. Yeah, one thing that gets talked about a lot in here is the vagus nerve specifically, and its importance when it comes to digestion and optimizing your gut microbiota. What do you guys think about the vagus nerve? Is it more to go to Vegas and everything that stays in Vegas out of Vegas, or what kind of vagus nerve we're talking about?
Oh, the thing that when you're doing like a cut down the neck, you say, "Do not cut this, or else the patient will die." Yeah, that vagus nerve. We know that in order for us to, right, we have let's back up. We have the autonomic nervous system is what we're referring to here.
Yeah.
And we've all heard that we have the fight or flight response, which is the sympathetic component.
Fight, flight, or freeze.
Flight, fright, or flight, freeze, fright, or
Are you freezing right now?
Are you freezing?
added a click. Needs my microbiota check here.
Yeah, it's not even all.
Well, I haven't fed them this morning, so they're everybody got it. Right. Speaking of what we're really controlled by here, me. And then we have our parasympathetic system, which is our rest and digest. And so when we talk about the vagus nerve, that we're really talking about the parasympathetic nervous system. And I believe you have a phenomenal lecture for those that have not reviewed it. And go find Scott, type in the sympathetic spiral of doom. Is that the one?
Yes, have music afterwards. Da 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 da.
So the vagus nerve is something that is governed by things like our state of relaxation. It's governed by our respiratory rate, our tidal volume, like how deep we're breathing, where we're breathing from. Most of us are breathing high in our chests. Most of us are sucking our guts because we're trying to, look good and not have, our belly sticking out, which is not a typical great look. So, but when we're thinking about digestion and we think about getting to this state, those are all really important to allow us to actually embrace digestion. We're talking about the gut, digestion as a whole.
What you're really talking about here is that the vagus nerve sort of is your driver of parasympathetic tone outside of your brain, right?
Yes.
And it's the innervation of the gut using the vagus nerve or via vagus nerve. That's a bidirectional flow. So there's flow.
Wait a minute. Board exam question. What number of what's the number of vagus nerve in the brain?
Is it 12?
10.
10. 10. Yeah.
And it's the longest, right? Because it traverses all the different body parts all the way down to the
Reproductive.
gonadal. Different things to the different organs, but it's always parasympathetic. Yes. And the only organ that doesn't receive any parasympathetic innervation from the vagus is the adrenal gland.
1 second, I added.
That's good.
The adrenals.
Yeah, it was funny, right? When we check for cranial nerve 10, what do most people do when they are nervous as a self-soothing mechanism? You might hear them hum, right?
Yeah.
That is actually an adaptive response to calm and try to actively stimulate the vagus nerve to find himself in a parasympathetic. So when we're humming or we're singing, those are signs.
But like if the humming is out of tune, does it still
Well, for me, if it's out of tune, that I'm sing like nobody's listening. It's okay. Yeah. If you're singing, you're humming,
You're
I'm
hungry. Hungry?
Yeah.
Well, I think what it comes down to is that if you don't have vagal tone, if you're in sympathetic all the time, there's no way you're going to be able to digest all of your food simply because you can't get enough blood flow to do it, right? That we are supposed to be able to calm down so our vagus nerve is activated, and so that we get enough splanchnic and additional blood flow going to the intestines themselves.
Well, you can also flip it around, right? So if your gut is inflamed all the time, you're getting a signal to your brain that the world is a hostile place. So you're just stressed out all the time. Your gut is a way for the body and your cells to sense its environment around us, and it adapts to that. So if it's hostile, if your gut's inflamed, all our cells think now it's our world is a bad place. And
I don't know what world you live in. My world is not hostile. Oh, kidding. It's very hostile.
well, now take over. You made me lose my train of thought. So
I mean, look, we're trying to have non-hostile environments as much as possible. And one of the things that, what we get asked about with our patients a lot is, about these trillions of microbes that we have in our gut. And Ted, I love the way you describe the gut oftentimes as well, I guess the skin as being your reverse gut, right?
Yeah.
In that capacity. Maybe talk a little bit about how you message this to your patients and talk about what a healthy microbiome actually looks like and what it versus a dysbiotic one and how this kind of manifests in various ways.
So the way I talk about this with my patients is in the concept of balancing. I tell them it's like an ecosystem of its own. And of course, I have to describe what an ecosystem is if we don't understand, right? However, they do understand very quickly, because when I tell them, like, if there's a significant number of organisms in there, 2 kilos that are in competition with each other, they compete and they cooperate with each other, right? And therefore, if you imbalance one, the competition will increase, or the cooperation between 2 species that will increase, and then that will totally balance the system. An example of that is, of course, in the forest floors, right? And in the forest, there's a competition for sunlight, for example, but there are species that don't like sunlight. So it's the same thing as in the gut. So when I explain that to patients, they begin to understand that I start with, hey, your gut microbiota actually pre-process everything that you eat. And then if you have an overgrowth of one, like for example, the 𝗱𝗃𝗃𝗃𝗃, they're very efficient at processing glucose, then you will be very efficient at processing glucose. And the reason why you're having an increased number of 𝗱𝗃𝗃𝗃 is you're eating a lot of refined sugar. And then eating a lot of refined sugar, you could see you're actually fasting blood glucose is here. And then you see fasting blood glucose, oops, your insulin resistance is up. And then you see your HbA1c, and you have not been eating well in the last few months. So you actually go and trace it from the beginning, right? And the beginning is sort of at microbiota.
Yeah. Anything to that?
Wouldn't it be nice if we could measure how your gut microbiome looks like?
Yeah, we're getting there. Good first shot. All right. Well, this it. Yeah.
This also jumps into the major framework shift that in health optimization that we talk about. So for someone who comes in and is having anxiety or just gut issues, we're going to send them to the GI specialist or the psychiatrist, and those clinicians are going to look at their patient in front of them through the lens of the psychiatrist. So only focus the brain, the mind, what we do from cognitive behavioral therapy. The GI specialist is going to focus on diet, but scope them up and down. Let's scope them. Let's get them on a PPI, which will, unfortunately off Dr. Ted over here. But in health optimization, we move from the level of the organ to looking at the body as a holobiont. And maybe, Dr. you're going to tell us what a holobiont is?
The holobiont is a way of looking at who we are as a person, not as just one organism, but actually a collection of trillions of cells in a network, which are made up of different species of cells from the animal kingdom. So we have our own human cells, monkey DNA. We have our mitochondria, which are endosymbionts actually. And we have our microbiome, all the bacteria in our gut, on our skin, and as we now know, also in our bladder and other places in our body.
No place is sterile.
No place is
You're
sterile.
saying some places are sterile.
No.
Sterile.
And molecules from your environment, your internal environment, your external environment, like pollutants. And all these molecules, they communicate in a network. And that is actually who you are, what you call your metabolic phenotype. I found this fascinating to think about. So all your microbiome partners, their genetic DNA is 100 times larger than your human DNA. So we think of ourselves as this monkey, but it's actually more of all these 8 trillions of aliens in and around us are more you than the monkey.
Who is running who?
I mean, to your point, what Dr. Tet, what he probably was going to say is that when we look at, we know the human body is a network of organs and various systems that are networked. And as we expand our framework shift, understanding that we are this multicellular organism and we're an ecosystem of different ecosystems, not just human, but microbiota and others, that we really need to rethink our gut microbiota as not something just separate, but as Dr. Ted refers to, it's really a post-natal organ. And when you really let that sink in for a moment, that means it's just as important as your heart, as your kidneys, as your liver. So if you take out any one of those, I mean, you die. You can't survive. So, and we know that if we wipe out our microbiota, or we don't have a healthy commensal flora, then we may not die immediately, but our chances of survival and our resiliency is significantly diminished.
It's so nice to listen to my students finally internalizing all of this, especially someone in acute care, taking emergency care. But yes, it takes a while. Like it took me, I said, even it took 3 years to actually shift my perspective. And I was someone who founded the framework, right? What I was going to say is that a friend of mine who founded the World Microbiota Society in Europe actually asked me, he said, Dad, who do you think rules us? He says, do we rule over the microbiota, or do the microbiota rule us? And he's just answered his own questions. I think we're just the tenants of the microbiota. And he's like, they use us for food, they determine how we feel and everything else. And they said, and when we die, they're still there. So that flips the issue. We look at the microbiota as a post-natal organ, but for him, it's just like, no. They're actually a separate entity that rules us, and we're just the fodder for their food.
That's it for now. Yeah, I mean, this goes into the conversation, I think, more about how we nourish the gut in general, and then how we can look at this from our lens as the gut immune system, as we think about it, and as we have been taught by Dr. Ted, and then in our modules that we have at HOMeHOPE.org. When you get questions from your patients about restricted diets, or what they should eat, what they shouldn't eat, how do you navigate this? Yeah, is it, let's just take everything out and see how you feel, or you're looking at data probably and going from there, right?
Probably, yes. So
Go for the blueberry diet. Blueberry diet. That's amazing.
now, everything we do or ideally do in clinical practice is based on a measurement, because otherwise you don't know what you're doing. And the pattern I have seen so many times now is, especially in like vegetarian people, they think they eat very healthy, but all the green leafy greens and the starches they eat just sit there fermenting in their gut, cause these microbes to flourish, but produce all this methane gas and bloating. And people think like, oh, more is better, I'm eating healthy, but actually they have bacterial overgrowth. And we can now measure these things, like what strains of bacteria is there overgrowth, and what does the population of bacteria actually look like. And then you can come up with targeted advice. So maybe don't eat as much starches, or fast some more so your body doesn't have to ferment so much food. And you can look at things like food sensitivities to actually be informed of what kind of foods trigger a reaction and what kind of foods don't.
Yeah, wasn't there a case here in the United States of a guy who was stopped for drunk driving, and his alcohol levels were up, and he swore he wasn't drinking, right? And it was actually because his gut microbiota was fermenting. So and so he actually was having alcohol the related symptoms. But it was only after they did an investigation that they came up, but he actually is going to jail for drug driving.
Wow.
We can measure these things now for our clients. And the gut does so much more than just digest it. It has to digest your food, but you have to be able to absorb it. Your gut is your primary immune system, your barrier against invaders from the outside world. So it has to have a properly functioning immune system. We can measure, are there signs of inflammation? You measure dysbiosis, so you can measure your whole microbiome. So the total quantity of microbes, and also what does that community of microbes consist of? Yeah, basically 7 big families of microbes, and we can measure how far off are these from a healthy cohort. As we said, these bacteria, they pre-process all your food to produce vitamins and minerals. So they have a big metabolic function, like producing short-chain fatty acids. And we can measure this in your stool, actually. And we see there are things like infections, like parasites or pathogenic bacteria that might be causing an issue. And then come up with very targeted protocols to actively address what's right, what's wrong. So we demystify or make it insightful and actionable this whole microbiome rainforest analogy we've been talking about, to make it actually clinical and practical for our patients to.
Yeah, as a quick guideline for clinicians here, really the tripartite axis of the gut-brain enteric microbiota, there are ways of communication that are known. One is the biggest nerve, so that's nervous system communication. Remember, communication is bidirectional, right? And then the second one would be through the hormonal system, like ACTH, right? So when you're stressed out, when you're nervous, example, you get butterflies in your stomach and all those kinds of things, right? And then there is the other one is by the immune system, right? They produce all of these molecules that indicate whether or not the gut is under attack, and the gut has been trained to, for example, in autoimmune diseases, right? One of the first things I do with them is I actually take a look on their gut microbiota picture, as Dr. up here actually mentioned. Right? It's because you can see, and you could usually see some overgrowth, and it on the whole picture it does add to the decrease in the severity of their signs and symptoms.
Yeah. And I think what we're talking about here is that if you have data to play with, you know exactly how to target things, as you mentioned, and also targeting diet. Sometimes it's people fiber maxing and having way too much fiber and then getting drunk, like Dr. Ted said. Other times they're having zero fiber and they don't have all those other gut bacteria that they need to pre-process their food. And so really, I understand that it's difficult to sometimes get a test because it's expensive. You have to find a clinician that you can work with. But as practitioners, if we have this data, we can really help target our patient to what they actually need. And oftentimes, as we've said before, subtract the things that they don't. And I think that's the big part of it. And so when we're doing this, guys, how long does it typically take to see meaningful rehabilitation of a gut microbiome? Are you seeing this in a couple weeks, in a couple months, in a couple years? What is your experience so far here?
Typically, usually 3 to 6 months. It depends, in my experience, a bit on how severe, say, a dysbiosis is, or a short-chain fatty acid deficiency. If you can supplement that, people will start to feel better very quickly. If, say, they have leaky gut and you supplement with butyrate and glutamine, they can feel better very quickly. But overall, shifting the population and keeping it stable in the right ratios takes time. And honestly, about 3 to 6 months, in my experience, with the minimum. Yeah.
There's a study that was done on elderly adults, and they found out that within about 72 hours of a different diet, the ratios actually start flipping. Right. So, for example, if you're jet lagging or and are in different place and are eating a different cuisine and so on, then it actually flips and contributes to the dysbiosis of your gut, right? And then it stabilizes if you are, actually are relocating to that area. So it just shows you that, we started this with you are what you eat. It still ends with you are what you eat, because even when you take a look at the dysbiosis is caused by jet lag or moving to another time zone, etc. As early as 72 hours, you can see changes in the gut microbiota.
Something interesting. I think we've all, hopefully this is relatable. If we are traveling or we say fall off the wagon for a diet, because we are human too, and sometimes we some of us are human. We're all exactly. We're all
Who's running who?
Who's running who? and say you're having a little too much cake and you're refined sugar, carbs, and you do that for a few days. What do you find that you notice different about what you crave and the type of food choices you make? You're gonna most likely find yourself craving more sugar, and I think it's a testament to the fact that what we eat is selectively feeding the particular strains of microbiota, and then as those grow and become dysbiotic, then if they're not being fed via you intaking those sugar molecules, then they're gonna secrete stress. We going back to what we talked about, if the gut is the largest repository of serotonin receptors, then they really hold the key to your happiness and your mood and your cravings. And so they in terms of who's driving who here, they are going to dictate and drive your behavior. And so it's surprising how easy it is to derail a healthy microbiome.
Just like antibiotics. That's a good way.
Yeah. Well, that's actually really interesting. So, as I am still in acute care, one of the battles that we are continually up against is that when patients come in and they have some type of viral illness, there is a sense that they want a pill. They want an antibiotic that's going to treat them. And I'll share how this has changed my practice in acute care. Is that sometimes it was just easier to give them an antibiotic, even if you knew it was a viral, and you just move on. You say, yeah, a macrolide or some second generation penicillin is not going to harm them.
Yeah, and you fulfill your statistics.
And then you just check, right? Move along and get them out, and I'm not going to get a complaint. And now, it's made, in some senses, it's made life a lot more challenging, because if I really have their best interest in mind, and I know they don't have bacterial infection, or I don't think they do, then I am really counseling them on these type of things. And I think that is something that for those of us that are still in the illness medicine realm, maybe you have primary care practice or urgent care, emergency, or you're anyone who uses antimicrobials, pharmaceutical grade, it's really something that keeping in the forefront, I think, is really going to help you, your practice, the patients.
Yeah, I just like to say something here. When the whole gut microbiota movement came about, the famous book is This Is Your Second Brain. So we look at the gut as actually a second brain, because it can actually function on its own. It can still be alive where you already brain dead, right? So it has its own neurotransmitters, and it actually function on its own, just as a separate organ. And as far as the serotonin that's produced in your brain, doesn't actually go by a different pathway. Don't confuse the two. There are what's called large neutral amino acid transporters in the brain for tryptophan, right? And those are the ones converted by the brain. So as much as 92% of your serotonin is actually produced in the gut, but it is used by the gut, right? The third thing that I had a picture of, which was trying to say earlier, is like if we are like the tenants of the microbiota, it's like imagine us lying down and then this blob of microbiota just crawling around us. It's like, let's eat up this sucker. Whee!
It gives you a different perspective on who's eating who. Well, guys, I think we'll wrap this one up. It's a really nice episode. I hope for all of you to get an understanding of how we think about the gut. I mean, there's lots of different things you can go out and do, get your probiotics, get your prebiotics, but have a foundation of all of this. This is what we do at HOMeHOPE. We have a gut immune system module. If you're a clinician, you can learn how to think about the gut as we've been describing it here today with lectures from the faculty. Just know that it takes time, right? It's not something that over the first couple of days. For me, I often see that people get worse before they get better, oftentimes. Because if you seal up a leaky gut, then you're going to see all the manifestation of the growth, not outside the gut, but inside the gut. And so I counsel my patients. It may look a little worse before we get better, and that's okay. Any further comments, anybody?
Wow. Isn't that a part of like the standard lore for physicians? It's like, take 2 aspirin and call me in the morning. Ladies, I don't get worse before it gets better. But this time it's actually true, right? That Because certain remember there are some tribes, for example, where Trypanemia, which is a species of syphilis, is actually native to their gut microbiota. It's on scavenging track. So remember, at any one time, these are competing, competing and cooperating.
Nice. That's together. Mid-word.
This species, right? So and when you throw them in imbalance, they will push to compete or they will push to operate. And in both cases, those can actually induce imbalance in your gut. And remember that your gut microbiota, the ratios of them are as unique as your thumbprint beginning 2 to 3 years old, right? So this can be measured now. And what is still missing from our current science is that we still cannot do targeted, oh, I want to replace only the following microbiota. We still don't have that, right? You don't have like custom probiotic for, Dr. Sherr, the only replaces. But I think we're going there, right? We're going there. We have better diagnostics to see this, and accounting doing the population count and developing better statistics now, because these are, remember, when they collect your stool, they mash, all of these things together. Have you seen that? Have you seen it done?
It's right. It's like the
So it's very dependent on sampling and all that. But we're developing better technologies to do that. And then, of course, there's no AI assisted reading, all of these things, which has a better estimation, right, of what's going on in the gut. So, don't guess, test. Yes. And the first thing to ask your patient is like, what are you eating?
or what's eating you.
Or what's eating you?
Correct. Thank you guys for listening to another episode of the Health Optimization Medicine Podcast, live in studio with Dr. Ted, Dr. Allen, Dr. Jup. We'll catch you all next time.